In this video, we'll discuss about sexual transmitted disease STD. What is STD? It is a group of communicable disease which are transmitted by means of which route? That is sexual route. So it is a group of communicable disease which are transmitted through sexual route. Main five classical STD is there. That is syphilis, gonorrhea, chancroid, lymphogranuloma venerum, granuloma incuneale, that is donovanosis. So what are the five main classical STDs? Syphilis, gonorrhea, chancroid, lymphogranuloma venerum, granuloma incuneale. Then common classification of STD based on their microbial transmission. First one is bacterial disease, viral disease, fungus and protozoan disease. First we want to discuss bacterial sexual transmitted disease. First one is chlamydia, gonorrhea and syphilis. What are the bacteria transmitted through sex? Chlamydia, gonorrhea and syphilis. Second one is viral transmitted, sexually transmitted disease. For our example, human papilloma virus, genital herpes, herpes simplex virus 1 and 2, then hepatitis B virus and AIDS, HIV. So viral sexual transmitted disease example, human papilloma virus, genital herpes, hepatitis B and HIV. Then among protozoan disease, Endemoeba histolytica, Giardia lamblia, Trichomonas vaginalis. So what are the protozoan sexual transmitted disease example? Endemoeba histolytica, Giardia lamblia and Trichomonas vaginalis. Then fungal disease example Candida albicans. Now clinical manifestation, that patient have genital ulcer because of syphilis, herpes genitalis, chancroid, donovanosis, lymphogranuloma venerum. That patient have genital ulcer because of this sexual transmitted disease. It may be syphilis, herpes genitalis, chancroid, donovanosis and lymphogranuloma venerum. In the case of urethral discharge, it may be gonorrhea and non-gonococcal urethritis. Causing agent chlamydia trachomatis. Then Mycobacterium genitalium, Mycoplasma hominis, Candida albicans and Trichomonas vaginalis. That patient have urethral discharge because of these are the microorganisms, gonorrhea and non-gonorrheal urethritis, then Mycobacterium, Mycoplasma, Candida and Trichomonas vaginalis. In the case of vaginal discharge because of valvovaginal candidiasis, this one two group, Candida albicans and non-albicans Candida. So candidiasis caused by Candida albicans and non-albicans Candida. Next, bacterial vaginosis, then trichomonal vaginitis caused by Trichomonas vaginalis. So, vaginal discharge caused by valvovaginal candidiasis. In this one, Candida albicans and non-Candida albicans. Then bacterial vaginosis, then trichomonal vaginitis. Next, symptoms are genital wart caused by virus, human papilloma virus. This one, Cantilloma acuminata. This one causing genital lesion. Then pelvic inflammatory disease caused by Neisseria gonorrhoeae chlamydia. Then other than that, some complication of STD, no genital lesion caused by HIV, hepatitis B virus, and C virus. So these are the things only systemic manifestation only. Next, complication because of sexual transmitted disease. That complications are infertility, then ectopic pregnancy, then chronic pelvic pain, then HIV infection, then fetal wastage, low birth weight, congenital infection, systemic infection, and sometimes it causes cervical cancer. So what are the complication? It will causes infertility. After that, it causes sometimes ectopic pregnancy because of that fetal wastage and low birth weight, then congenital infection. Other common causes systemic infection, cervical cancer, and HIV infection. HIV infection means all the group of diseases it will causes. Then laboratory diagnosis based on the site we collected samples. Here specimen. So any discharges we collected mainly genital herpes fluid that discharge we collected. After a sample collection, discharges or fluid collection, then we will do microscopy. In the case of trichomoniasis and candidiasis, by using wet mount examination we can identify it. So trichomoniasis and candidiasis by using wet mount examination. Then gram staining we can isolated bacterial vaginosis, gonorrhea, and candidiasis. So gonorrhea, candida, and bacterial vaginosis by using gram staining we can identify it. Then Giemsa staining we can identify the Donovan bodies and inclusion bodies, Klebsiella and Chlamydia. Then in the case of syphilis we need the Treponema pallidum identification, we need a dark field microscope and a silver implication method. So syphilis, what are the method? Dark field microscopy and silver implication method. Then culture, different type of culture medium we are using for identification of different microbes. In the case of Neisseria gonorrhoeae we are using Thayer Martin medium. Then chocolate agar medium. Then we can use McCoy cell line for chlamydia and saffros dextrose agar, then cell line for monkey kidney for herpes simplex virus. So what are the culture medium? Thayer Martin medium, chocolate agar medium, then McCoy cell line, saffros dextrose agar, and cell line vero, that monkey kidney cell line we are using for herpes simplex virus. Then serological technique VDRL, Venereal Disease Research Laboratory, and RPR, Rapid Plasma Reaction Test. Then molecular technique PCR polymerase chain reaction, and RT-PCR, reverse transcriptase polymerase chain reaction test we can use. It is a communicable disease. Then classification: bacterial disease, viral disease, then protozoan disease, fungal disease, then local manifestation symptoms, then genital ward, pelvic inflammatory disease, then HIV, hepatitis B and C means no genital lesion, complication mainly infertility and ectopic pregnancy, cervical cancer, laboratory diagnosis, discharge and fluid in the case of genital herpes. Then microscopic method, culturing method, serological and molecular biological technique. Thanks for watching. This is all about sexual transmitted disease.